Tonight, we're learning more about the search for solutions to violence here in Indianapolis. A study from the Regan Street Institute and the Indiana University School of Medicine is laying out some ideas. Our Amber Grigley is live in studio tonight to explain what those solutions are and, Amber, how they can be implemented moving forward.
Nicole, one of the researchers who worked on this study tells me there are so many moving parts when it comes to reducing the impact of violence in the community. Now, in the study, 10 groups of innovation forum participants, including members of the community, scientists, public safety, and healthcare providers, generated 162 potential solutions to community violence. Malas Bustani with IU School of Medicine tells me a lot of the ideas align with CDC recommendations to reduce violence.
The big one is connections and communications. That's the big one. That doesn't require new resources. It doesn't require a new innovation. It's just simply our community found there's a lot of resources. Just from this kind of conversation, there's been a lot of resources in the community, and there's a lot of need in the community. The connection with them.
Now, some of the other solutions include limiting gun access, changing policies to decrease school expulsions of children who become involved in the criminal justice system, limiting promotion of risk factors such as alcohol use, altering policies related to affordable housing, increasing employment, vocational skills, and trade programs. So the big question tonight, what's next? Bustani says Eskenazi Health has already been championing most of those solutions through their program, HOPE, a hospital-based violence reduction program. He says this process is a marathon, not a sprint, and right now it is important to properly plan this rollout and educate along the way.
Our job is to continue to have time and space with them and the community and develop together a website that already exists in the Office of Public Safety. We can just distribute it more, share it with more, maybe expand it more. That's really important step that we're gonna do. And then try to spread the word more about the hospital-based violence reduction program at Eskenazi.
Last year and the year before.
The City of Indianapolis Office of Public Health and Safety helped fund this research. Now, in a statement sent to me tonight, they say since Mayor Hogshead rolled out his gun violence reduction strategy 3 years ago, both fatal and non-fatal shootings are down by nearly 30%. OPHS says, quote, the comprehensive approach to reducing crime involves investments in law enforcement, behavioral health services, and community-based efforts to address the root causes of violent crime. And the city's efforts overlap with recommendations from the study, such as increasing employment, vocational skills, and trade programs. Bustani says, knowing that some of their recommended solutions Indianapolis already has in place, seeing a decline in violence rates is a positive reinforcement that this method can be successful in various communities. Nicole?
All right, Amber, thank you.